Recorded 12,513 new COVID-19 cases in the past 24-hour cycle. Gauteng remains the leading province with the highest cases of infections with 7,543, followed by the Western Cape with 1,261. Limpopo coming in at number 3 with 800, and 66. 566 people have been admitted to hospital in the past 24 hours. And a further 331 COVID-19 related deaths have been reported, bringing the total number of fatalities now to 62,171 to date. Right, we shift now our focus to Mpumalanga, which accounts for 4.8% of all the infections in the country. The province will begin its vaccination of SAPS staffers on Thursday with the aim to inoculate 11,000 employees at 11 registered sites. To talk to us more about the province's capacity to fight the COVID-19 third wave, I'm joined now by the Health MEC there, Sasekani Manzini. MEC, good evening, and thank you for your time tonight on In Focus.
Evening to you, Thabo, and to the viewers at home.
When you were presenting your budget speech to the legislature, you mentioned that in your own department, 2,942 of your staff were affected by the virus and unfortunately losing their 59. What is the province looking at right now in as far as the infections are concerned? Give us the latest update.
Yes, you are correct that during our policy and budget speech we were concerned, but we're seeing the number decreasing. But currently we are concerned because we are seeing the number of active cases that need an urgent attention, because we are sitting at 6,467, which is 6.5%. And that on its own is something that we're always saying to our communities, let us adhere to the health protocol so that we don't see our numbers increasing. So we are putting plans in place that will cap the spread of the virus. Of course, if you want to deal with the COVID-19, you must focus on your contact traces and your case management and your case follow-up so that we are able to deal with the source of the ongoing community transmission that we are seeing currently in the province, of which is something that as a province, we are now putting teams in place in the different municipalities, focusing on the hotspot that are already the top 4, city of Mbombela, Malahleni, Sipset, and Garden Bay.
Which variant of the strain of COVID-19 is currently dominant in the province?
Yes, currently we have also been told that it has been the Delta has been detected in the province. But however, we are still waiting for the full report that will indicate exact where in the province as far as the different municipalities, so that we can manage the spreading of the COVID-19 in that different parts. Remember that the Delta is spreading quickly, and that means that we need to make sure that our people adhere to the health protocol and make sure that we work with different key stakeholders. Of course, the Honorable Premier is leading in terms of assisting us to make sure that everyone, in terms of their behavior, they change their behavior so that we are able to curb the spread of the virus in the province.
Let's look at some of the numbers also that you mentioned. 10 out of 32 hospitals in the province have achieved the ideal status, while only 96 out of 280 primary health care facilities have achieved the ideal status. How is this affecting your work?
Of course, we are working towards making sure that all our facilities are ideal, but you'll understand that the issue of infrastructure in the main is a challenge that we need to deal with the backlog of the infrastructure. But from time to time, we manage to make sure that other facilities are maintained, other facilities are extended, so that we are able to have all in the main our clinics. That is of a serious challenge, of course, because the focus will be on primary health care. But we are also focusing on making sure that as much as we are dealing with your renovation, your maintenance, but also different hospitals that also need urgent attention are done, and also our different levels, your district, your tertiary, and also your regional. So that's where we are focusing in making sure that all our facilities are ideal. And of course, in preparation for the NHI, we are appreciating that most of our facilities in one of the districts that was a pilot project, which is the Garsibande, most of the clinics there, in terms of your IT system, your security, we are doing well, meaning that we are preparing towards making sure that all our facilities but of course, COVID-19 Thabo is not assisting in terms of the budgetary constraints, budget cuts, that we have to redirect some of the funds to dealing with COVID-19. But of course, we shall make sure that we continue in terms of making sure that our facilities are ideal moving forward.
How are these budgetary complaints or constraints affecting you as far as staff capacity is concerned? I mean, with the number of hospital admissions that we normally see that comes with the various waves of the pandemic, you would need a lot of staff to be able to respond.
Of course, you know that in terms of human resource, even before COVID-19, as a Department of Health, we had a challenge. Hence, in terms of the presidential summit, shortage of staff was one key areas that was identified as that need to be addressed. So now that we need to deal with the third wave, we need to deal with the vaccine rollout, and we need to deal with making sure that services in the different facilities does continue. It will have, we are of course having a challenge. Hence now, as I'm speaking to you, we are in an NHC meeting where we are discussing to say, how can we assist in terms of making sure that the human resources that we are currently struggling with, that need to be divided amongst all these services, but of course prioritizing that the health of our people, the services that we normally provide, so that we are continuing in achieving in terms of making sure that other services are not compromised. So of course, human resources is a problem, budgetary constraint is a challenge, because if we talk about budgetary cuts, dealing with COVID, also as a department, we are affected. So indeed, it's something that we are discussing, something that we are trying to make sure that we find a balance in dealing with the COVID-19, but also making sure that other services are not compromised.
3 weeks ago, MEC, you were reporting 63,000 or so, just above, people having been vaccinated in the province. And of that number, 21,000 were actually health care workers. 3 weeks later, has that number shifted at all?
Yes, of course, we are seeing a number of increase, especially because you will remember that we started with elderly people in the province and around 333 elderly people that we are having. But that number has increased. But of course, the challenge that we have faced is that we have seen that quite a number of people now are not coming out in their numbers to make sure that they vaccinate. So, but we are continuously working with different key stakeholders in making sure that they are mobilized to come and take the vaccine. But of course, as far as we are concerned, the sector rollout that we are seeing of your educators is assisting us also as a province, and also now as CPS. That only means that they are easily mobilized and they will be able to be vaccinated easily. But of course, as we are saying, we are saying as NHC that the 50 years and above that we are rolling out, it will mobilize even more people to come and receive their vaccine, because that has minimized the challenges that we are facing. What we have also realized is that you open more sites, like in the province. Mpumalanga is a rural province. So it's very important that as and when you open this site, you mobilize around those different communities. But where we are, we can safely say that we were able to mobilize more than 28,000 of educators that have been vaccinated so far. And now that we are moving towards the 50 years in the province also, 136,189 of 60 years have been vaccinated. But now we believe that 50 years are able to register quickly. The process will unfold quickly, and we'll have more people coming in their numbers. So, of course, that's what we are working towards, making sure that everyone is vaccinated in the province, working with national in terms of the doses that are going to be allocated as a province.
Yeah. 330,000 is a huge number, and you don't seem to have actually moved a needle on that number of the 60-year-olds. What's the problem? Is there vaccine hesitancy, and how are you responding to it?
Of course, even in terms of the numbers of the educators, that tells you that it's not everyone who are coming out to vaccinate. But we are happy that we have seen leadership of the union coming out, the Ministry of Education being the first person to take the vaccine. But of course, you remember that you can't even force people to come and vaccinate. But the turnout so far, we believe that if we can get 60% per sector, while we move towards other different sectors, those that have not vaccinated, they will see that you can take the vaccine, is safe, and they will then be encouraged. Like I know that other people, as we started with healthcare workers, they didn't take it at the beginning, but as we roll out to different sectors, now they are coming out to say, no, we can see that our colleagues have taken the vaccine and they are safe. So we are going to continue to make sure, hence the introduction of the 50 years and above, it will assist in terms of mobilizing our communities to come in their numbers and take the vaccine so that at least 67% of the community are vaccinated.
All right, let's talk then about the police. 11,000 is the target for the SAPS vaccine rollout. How many are registered right now?
Remember, the process of the SAPS, we are not doing it as a department, but we are working closely. On Thursday, we are launching the rollout of the SAPS. That's when we are going to get the correct numbers as far as how many policemen are going to be vaccinated. But of course, we'll monitor that, even though SAPS have got their own vaccine, their own company that will make sure that they give their own employees in the different facilities. But we work hand in hand with the provincial commissioner in the province so that we are also monitoring, because at the end, they will also, if we've got some problems in the province, we as a department will have to come in and assist. Hence, we work hand in hand as we launch on Thursday the rollout in the province.
All right, MEC, I appreciate your time and thank you very much for joining us when we continue.